Welcome to Integrated Medicine Perspective. I'm Dr. Wendy Liu. Kidney stones is a common urinary tract disease in the US, affecting approximately 9% of the population. Calcium stones are the most common type of kidney stones. Managing kidney stones can be challenging because they often recur, so prevention is key to long-term management. One question that arises is whether people with kidney stones should follow a low calcium diet. In other words, do people with kidney stones have too much calcium in storage, so they actually have to reduce dietary calcium intake? Now, if that is the case, people with kidney stones should have a lower rate of osteoporosis. So, is that true in real life? Let's find out. Let's first dive into a 1997 study by Dr. Gary Curhan based on a nurse health survey. The study included over 91,700 women and spanned over 12 years. The study revealed that people who took calcium supplement had a 20% higher risk of kidney stones compared to those who did not. This finding supports the consideration of a low calcium diet for people with kidney stones. However, in the same study, the relationship between dietary calcium, not calcium supplement, and kidney stone risks tells us a completely different story. Surprisingly, higher dietary calcium intake was associated with a lower risk of kidney stones. In fact, individuals with the highest calcium intake, over 1,100 milligrams per day, had a 35% lower rate of kidney stones compared with those with the lowest calcium intake, less than 488 milligram per day. Now, the difference is quite significant. These study findings have been supported by other studies as well. Now, do people with kidney stones have a lower rate of osteoporosis? A 2021 study by Dr. Kalyani Ganesan involving over 500,000 veterans reported that almost 1/4 of people with kidney stones had osteoporosis or prior fractures. These studies tell us that an adequate dietary intake of calcium is not a risk factor for kidney stones. And the issue with kidney stones is not calcium overload. So why does the effect of dietary calcium differ so greatly from calcium supplement when it comes to kidney stone risks? One explanation lies in how calcium and oxalate interact in the digestive tract. When dietary calcium is limited, oxalate absorption increases and increased urinary oxalate concentration, which promote kidney stone formation. On the other hand, high content of dietary calcium reduces oxalate absorption. Calcium supplements, however, are often taken separately from meals, which does not reduce oxalate absorption. When taken on an empty stomach, calcium supplements are absorbed much more efficiently, resulting in increased urinary calcium concentration, which promote calcium stone formation. Another factor is that when calcium is obtained through food sources, it comes with other nutrients. For instance, dietary phosphorus intake can reduce urinary calcium concentration, thus reduce kidney stone risks. Additionally, food sources rich in citric acid can increase urinary citric acid levels, which act as a potent inhibitor of kidney stone formation. So instead of recommending timing calcium supplement with meals to reduce oxalate absorption, I would strongly encourage people to obtain calcium through food sources because the benefits of the dietary approach to calcium intake is likely outweigh the single nutrient approach of calcium supplementation. That's all for today's discussion. Please leave comments and questions. I will see you soon.